Hey everybody, I am Diana Braun from the Knee Zone. I'm joined with my husband and expert surgeon, Dr. Raj Sinha.
Am I harming my knee that needs surgery by wearing a brace? If you're unstable, no. If you're not unstable, there is some suggestion that people can lose some muscle mass by wearing a brace unnecessarily, but it depends on the type of brace. For example, if you're wearing an unloader brace, then no, it's not doing any harm. If you're wearing just a regular hinge brace that's not unloading the joint, then potentially, but I think you're pretty close to surgery, so I wouldn't worry about it at this point.
Yeah.
What is too long?
What is too long? Yeah, well, hopefully you've heard enough about that today, Bonnie, already. What is too long? I waited 10 years. Here I am. I would, everyone's on their own time when we have life commitments. I get it. So if you're ready for it, shameless plug again, go to Amazon, get our book. It's going to better mentally prepare you, physically prepare you. I think that you'll be happy. Again, are you going to be happy the first month? No. Second month? Probably not. Third month? Maybe you'll start to feel better. In about 6 to 9 months, you'll be really happy you did it for most people.
What I would say is knee replacement is a lifestyle altering device. Decision and surgery. It is not life-threatening.
Yeah.
Arthritis is not life-threatening.
Yeah, it's not going to kill you.
You're not going to die from your knee arthritis. When I say waiting too long, what I'm talking about is patient-reported outcomes. So we do a lot of research on how people recover from the surgery and what level of activity they're going to get, and we have all these databases and we have all these little scoring methodologies. So people who we feel have waited too long are people who don't do as well as people who didn't wait too long. But there's no way to measure what is too long.
Yeah,
that's the unfortunate thing. I can't measure your quadriceps function and say, oh, you've waited too long. Now there's no reason to do the surgery. We're still going to do it. You're just not going to do as well as if you had the surgery a couple years earlier. You're still going to be better. Pain's going to be mostly gone. Like I said, it's not going to, you're not going to drop from, 7 out of 10 pain all the time to 0 out of 10 pain all the time. Some people do. Her left knee is like that, but it's a relative drop, right? So if you hadn't waited too long, you might drop from 7 to 1. Now that you waited too long, you're going to drop from 7 to 2 or 3. 3 is still what we consider mild pain, So that's the thing, But again, it's a hard thing to say for sure. But most people know when they're ready.
Yeah.
Once you know you're ready, then don't wait.
Yeah, then
that's
don't
what
wait.
I would say.
Yeah.
I'm talking about her knee. Her knee is crooked. Will it be straight after surgery? Yes. That's one of the things we do to balance the ligaments. Is we have to straighten the knee out.
Thank you. I hope this was helpful. We'll look forward to seeing you next week. And be kind to yourself and your knee. Knee replacement's hard. It's not easy, but it's worth it. I can promise you.